Welcome to the second episode where we talk about value, we talk about being a dentist, we talk about success, happiness, we talk about virtual consultation, and why not throw a little bit of French in there. I'm Stephane Reinhardt, Director of Education for the C.L.E.A.R Institute, and together with my friend Gerry Samson, we're just making sure that the center of rotation stays outside of the box. Welcome to the Odd Couple.
Now, all of these things actually are interesting because what we originally talked about doing for this podcast, and I'm certain this will get split into different segments because you're the editor of it, but I mean, we're following that whole thing of value of what's interesting to us. And you know, anybody who listens to this for more than 45 or 65 seconds probably thinks, now, what are they talking? This is interesting. What are they talking about? They're not just talking about teeth.
You said that this is supposed to be, I read here, it's a dental and life podcast. Where's the dental part?
Well, for us, they're kind of mixed together. You know, it's sort of like the definition of success. Well, if you're a dentist, but you're not happy, would you call that success? Yeah. I wouldn't. No. I mean, it's my comment about general dentistry is the most difficult specialty of all. Mm-hmm. I know a lot of dentists, not personally, but I do know quite a few that given a choice, they would like to quit general dentistry. Bang. They'd like to be, or they'll say, well, I should have specialized, or if I had it to do over again, you know, would you be a dentist? You know, it's interesting how many say, well, no, I wouldn't.
Well, and sometimes I ask if we would be in a perfect socialist country where everybody makes the same thing, would you choose to be a dentist? If you could make the same living doing anything else, would you choose to be a dentist? How many do you think would say, yes, this is exactly what I would do?
This is a fantastic question. So what about you? Would you?
No.
No?
No.
What would you do?
I would be a rock star. I would really for real. I would be a musician. I would be a comedian. I would paint. I would do anything with, related to art. This is exactly what I would do.
Art other than dental art.
Yeah, well, I think what brought me into dental art, that part of dentistry, that part of art really was interesting for me. Really. When I think back of, now I do only the clear aligners, but when I think back of when I was doing, composites or things, I could take time to make some grooves and for me, it was important. Even if I look back when I was doing amalgams, I wanted to reproduce, even if we don't care. I was on a first molar, a second molar. I had to do these things and take time to do them. For me, it was satisfying for me, even though we don't care about the patient. I remember that sometimes I wanted to do grooves on the composite and color them and everything. And you think about that, it's just, how many times did I do that? And I had to remove everything because I was adjusting the occlusion at the end. See, looking back to say, oh shit.
Well,
but I always liked this part of where I could be creative. I like creativity. I like all these. So of course, if you ask me, what if I would do the same thing, knowing I could have the exact same living, I would probably not do it. But was I happy being a dentist? Yes. I do not regret, I could have said, yeah, well, you know what? I regret it because I should have gone into art but I found a way to be able to mix both. Why do you think I lecture? Why do you think I take so much pleasure in lecturing? Because it mixes everything that I like together. It's about dentistry. It's about what I did, about what I know. I can share it. I can be on a stage. I can do these things, these podcasts, these videos. It's now for me, now it's like the perfect life. I'm having fun like I never had before because I can mix all those things together. But I found, it was a plan that I had for a long time that someday I'm going to do something like that. It's just, you cannot do that when you have no experience. You cannot, what do you want me to say it after 2 years of practice? So you have to reach a certain level. And I think I'm at a point now, and you can probably tell me because you've been there. I think when you reach like 50, you probably are at the point where you have a lot to share. And I look at young dentists, they are much more patient than I am now. I was really patient. But one thing that I can see that changes with time is I'm becoming less patient.
Really?
Yeah. In some areas, some things, as a dentist, there's things sometimes that like just, no, I don't, that I could have spent so much time in trying to, that I think I'm less patient now. As a dentist at the chair, doing things that, I don't have to do this. It doesn't bring me anything. This is not what I want to do anymore. I want to teach you how to do it. I look at young dentists now. I want to teach them. I want to show them. I have more pleasure in sharing and showing others than doing it myself. Does that make sense?
Well, it's quite interesting because I've been out of my private practice. I stopped private practice 4 years ago. But I think the patients being patient versus treating patients. I want to make that distinction in the terminology. I'm a lot more patient now than I ever used to be. I used to be really intolerant very intolerant. I kind of enjoyed it actually, and very impatient. And but what in private practice, I was scaling back the numbers so significantly. At my busiest, how my private practice was, it was just me and one assistant and one front desk. And maybe people listening to us may not know that about me. But for a U.S. orthodontist, I know this comes as a shock, but I had a very strange operation. One office, one assistant, one front desk person,
one patient,
no insurance. People told me in the beginning, "Oh, you've got to cut your hair, you got to wear a tie, you got to hire more people, you've got to see at least 70 or 80 patients a day. You'll never make enough money." And you're very familiar with my family background that my father never finished high school, and my grandparents on both sides were illiterate immigrants. And I don't mean English, I mean Russian. They never went to school in Russia. They were peasants. There was no school. So it's not like I was born with money. That's a different situation, completely different situation. I had a very small practice, and therefore I had very small problems. And I would choose to do the same thing again, even though I'm a corporate consultant for large numbers. My niche was this concierge or boutique. How do you say concierge in French?
Concierge.
See, it
exactly
sounds
the
so
same.
No. Now you sound much better.
Concierge.
Oh, Dios mío! And what about?
We say concierge. Everything sounds sexy in French. No?
How about boutique? Boutique. Say boutique.
Boutique. Alors, Gerry, tu avais une pratique de boutique concierge.
Yeah. What's in a name? So, at my very busiest, I was seeing 30, maybe 40 patients a day, but I hated it when it was that busy. Now, my point, Stephane, is that I was scaling back because my education career in Gnathos was going in this direction, while my practice, I was steering into that direction. Because I wanted enough time to take photographs. I wanted enough time to think about what I was doing and what the different choices are. I wanted enough time to make very careful notes about what I was thinking chairside, what I thought was going to happen at the next visit, which is why orthodontics is so low stress. You make an adjustment, and then you wait 4 or 6 weeks and you see if it worked.
Yes.
And if it didn't work,
and you react to what happened. Yes, that's it. Right. This is what I'm saying all the time. So why are you stressed? You know, it's not like you have only one appointment to do everything. You have a year and a half. You can change your treatment plan. You can just react to what happened.
Yeah. Well, versus the very difficult specialty of general dentistry where the patient's there and you got to get that dude done now. And people don't like coming to the general dentist. I mean, you flash a light in their eyes, you spike them with a needle. I mean, then they're, I mean, nothing like that.
And you have to pay.
Oh, and then you pay for this privilege. Yes.
Yeah, that's it.
I mean, it's very, very difficult to create an atmosphere where people really enjoy it. It can be done. And those are the gifted leaders, the gifted managers in dentistry, that they actually have a vision and they make it happen. It's not luck. They hire the right people. They pay them a fair, if not a generous amount of money, and they're directing the band. It's time to join up and leave your problems. It's like the wonderful movie Cabaret with Joel Grey and Liza Minnelli. Come to the cabaret. Mm-hmm. Have a good time. Mm-hmm. Pretend you're having a good time. Orthodontics is much easier for that, don't you think?
I do think. Yeah, that's it. And it's probably one of the reasons why I decided to do only this. There's a couple of reasons. It's because of this. And it's also because I think this is the part of dentistry where you can build the most, again, about fun, but the most fun relation with your patients, because you see them a lot of times. And it's hard to build that same type of relation with other patients. You can, of course, over years, but because of orthodontic, because of the way we're seeing your patient every 6, 8, or 10 weeks, you build that relation. And I have a much better, much funnier relation with my orthodontic patients because of that.
Let me ask you a question about that. And the question is directly targeting the paradigm shift that's happening in dentistry, but it's been going on in medicine for quite a while. Teledentistry, telemedicine. It is and I have a conduit into what's happening in the American Dental Association. It's actually been published. I have a print. You can find it on the internet. I mean, it's public information for anybody. The American Dental Association updates teledentistry, 5 things you need to know. Okay, so now if you're practicing dentistry in the USA, this would be considered an influence over the standard of care, which I'm sure in Canada is as big an issue. Like, are you within the standard of care, right?
Mm-hmm. Of course.
Here, this is the number one thing listed. I don't know if they're listed in order. Teledentistry services, quote, must be consistent with how they would be delivered in person, end quote, and, quote, based on the same level of information that would be available in an in-person environment, end quote. The American Dental Association said that dentists have a legal obligation to ensure all records they collect can sufficiently lead them to make an accurate diagnosis and treatment plan. And they're talking about teledentistry. Now, does that sound realistic to you? Because it doesn't to me. You can't have the same, you can't get the same information is when, or when can you is what I'm asking. What do you think about that?
Well,
I can tell you that my information, Stephane, is it's not how it works in medicine, which my understanding, and I don't want to mention who explained this to me because I haven't talked to this person specifically and said, now, did I understand you correctly when we had this conversation? So I'm going to paraphrase what I was told, which I do think is accurate. For example, telemedicine. You can get a lot about diagnosis talking to the patient virtually over a Zoom call or VMA. You can get a tremendous amount of information. I mean, I think that you could diagnose the symptoms of COVID by talking to somebody virtually. I think you can, and my information is that's pretty well accepted. You can't get a cell test to see if they have the virus. Okay. But you can sure get a good idea. Like, do you need to go to the hospital? Do you need to go to an emergency care facility? Do you need to self-quarantine? How dangerous is it? But in dentistry, based on this, they're saying must be consistent with how it would be delivered in person. I mean, tell me what you think about that as first as a general dentist, and then we'll talk about orthodontics. What do you think about that?
I see it like two completely different things that you cannot even mix together. You can like that saying, that it has to be like, you have to recreate almost from what I understand. Maybe I don't understand it well, but what you just read is that you can do virtual consult, but you have to recreate what you would do. You could do live. I mean, it's two completely different things.
Yeah, you can't. How can you use a mirror and an explorer?
Yeah, but that's it. I mean, a lot of what we're doing is about feeling.
Yeah.
You know, how many times did you say just palpate? When you do a consultation, palpate the bone just to you feel the roots. You cannot do these things, but I think it can complete. Like you want to do virtual consultation. You just want to know, are we a good fit? We're talking about orthodontics. A lot of times when I lecture, I tell dentists, don't choose your cases based on the teeth. Choose your cases based on the patient. Are you
well said? That's those of you listening to this, you want to replay that again, and you need to let your team hear this, because I'm very biased, but I think that women have a much better, but certainly a different perspective on, is this a good fit? Go ahead.
But that's it. Because you can always manage teeth. You can always find the ways to go around if you have a problem, whatever. But if you cannot manage your patient, that's it. It's gone. It will not be fun. And exactly like you said, you're going to have, every time you're going to see that name on your schedule in the morning, even though you have 100 patients in the day, that patient will make it a bad day. You don't want that. So don't choose your patient based on the teeth, but choose your patient based on the relation you're going to have with them, because it's going to be a long-term relationship. You're going to be married with them. You want to get married with, that's it. They're going to be in your office for a long time. And this is what you want. You just, especially if you're a general dentist, you're doing the orthodontic part. and let's say somebody consults you only for that, you don't want them only for that. You want them for everything else. You want them to become a regular patient of your office. You want their family. You want their friends. You want their co-workers. You want them to refer you patients. This is what you need. You want a healthy practice. This is what you need. So I think this virtual appointments can be good. One of the things that could be good for that, for virtual consult, not to evaluate your teeth or whatever, but just to see, are we a good fit? And it works on both sides. It could be good for emergencies. And especially, I will give you an example with me. A patient loses an attachment, or a clear aligner patient loses an attachment. I don't necessarily need them to go to the office for that, to show me. And sometimes it can wait. If we could have this virtual thing, they could even show me. I could see if it's there or not anymore. I think I see it really as something that will complete, but will never replace what we can do live. And I compare it exactly to the lectures we're giving, where now it's really, we do these things, these podcasts, and we have online courses and Zooms and everything. But even though it's really practical, it's fun, it will never replace the live experience. You have all these shows on Netflix. You can watch your idols, your rock star, the ones you can watch, Bruce Springsteen, whatever. You can all watch them on your big screen, and even if you have your home theater with the big screen and everything, and you have the best
sound system
and everything, it will never be like seeing Bruce Springsteen live on stage. It cannot be the same.
For Springsteen, I would agree it's not the same. I've seen him probably a half dozen times. And you talk about an experience that takes you on a ride, for hours. I think of all the times I've seen him, there was one song that he did where the momentum wasn't there.
Okay.
And the feeling from the audience, the audience was not with him on one song of all those songs. And I could see, because I had very good seats, I could see he felt it as well. But for others, like I'm a big fan of Steely Dan, for example, and I've seen them live. But as far as the sound quality, I'd rather listen to my own stereo.
Yeah. Mm-hmm.
Because it's not a real performance.
Yeah.
It was interesting, but I thought, the Eagles, I saw them when all of them were still alive a number of years ago. Mm-hmm. The sound quality was unbelievably good. And I was in the stadium or the venue in probably what would have been the best place to sit for the sound, but I wasn't that close. Mm-hmm. So the experience, I thought, well, for $250 US a ticket, I thought, I won't be doing this again. Uh-huh. The experience. What experience are you creating? And what you and I are both wanting to do is to create a valuable experience, an engaging experience, an experience where people feel emotionally better from watching us and hearing what we have to say, even though it's on a screen and it's a recording.
That's it.
They feel better for having watched it or watching a piece of it, and they come back to it. So the teledentistry, I think I'm not going to mention the dental legal authority. I'm sure you know who I'm talking about, but there is a number of individuals, but one particular person who I would consider to be in the category of the leading authorities in teledentistry in the USA. So he's a dentist and an attorney. He also has some specialty degrees, and I'll leave it at that because I am not going to quote this individual without checking it with him. Mm-hmm. But there will be a link, which I'll invite Stephane to put below the podcast, and it says Teledentistry. That's what the link will say. It's a YouTube. There's Teledentistry and other things in business. You can click the link and you can hear what this individual has to say in his own words. Uh-huh. Now, I think that what's important to realize is that as far as any liability, which we all need to be concerned about, both ethically as well as legally, is can you make a decision with a virtual visit, whether it's in any type of dentistry, any type? Can you make a decision without seeing the patient live in the office with a light and magnifiers and a mirror and explore whatever you need, x-rays? Can you make that decision virtually? In other words, that is what you're deciding is, do I need to see you in the office, and how quickly do I need to see you? Now, what is interesting about the dental legal authority is this person makes it a point of saying, make sure you document this. Here's how, do I need to see you in a few days? Do I need to see you right now? I mean, like, do you need to get up and get in your car and we'll put on all the personal protective gear? And do I need to do that now? Are you a patient of record in the office? Or is this someone you don't know? Now, there is a huge issue because, first of all, the documentation is simple. You record it with Zoom or whatever you're using. Record it. Now, there's no question who said what and what the reaction. It's the ultimate, according to the risk management people. I am not an attorney. I'm not pretending to be one, but I'm aware that this is the ultimate, is a voice and visual recording. You didn't say that? You didn't make that clear to me? Excuse me. And then you make sure that that's kept as an important part of the patient's record. Now, that's really all you're doing. Like, how long can you wait? And if it is not, how are these people doing this over podcasts, live ones, where ask the doctor? Well, this is what they're doing is they'll say, well, you know what, based on what you're telling me, this that you've seen on your hand or on your arm or on your neck, you really need to see a dermatologist soon. Like, make the appointment right now. That's how they're dealing with not only the legal issue, which I think is of interest, but it's more an ethical issue that I'm interested in. And I think a lot of those things can be, I think, not you, not the American Dental Association, not the Canadian Dental Association. I think a tremendous amount of information can be gathered about, do you need to see the patient, and do you explain to them why and when? That's a very small investment in your time. And if it's a patient of record, well, how do you charge for that? Well, right now, that's a big issue in dentistry, because I believe in medicine in the U.S. that they're making allowances for virtual visits that they will pay for, which they should pay for. And everybody's happy. No risk of COVID, no PPE, no getting in the car, no risk of a car wreck, no risk of a car breakdown. I mean, it's very, very attractive. And you don't have that issue in Georgia, but here it's all, winter is coming now. And I have patients coming from 2 hours from the clinic and everything. And when you have this snowstorm and the ice and all these crazy things, sometimes, yes, it can be handy to do it. But well, the perfect thing is what you did right in the beginning of COVID. You did a highly attended YouTube on here's what your clear aligner patients need to know. Yeah, I think you had thousands of people. It's still there. Yeah, of course. Yeah, so I'm sure you'll put a link for it. Yeah, it's there. It's always good in any pandemic. But anything that prevents you from going to
So it could be a snowstorm, it could be exactly, you cannot go. Well, this is what you should do if you cannot see your dentist. That's it. So yes, it says COVID, but it's any situation where you cannot go to your follow-up appointment, or you're just wondering, I just broke my retainer or whatever. Yeah, it's there. So if you want to, link your patients to that, it's really useful.
Yeah. And I think the whole team should see it.
Yeah.
I think everybody on the team, on your professional team in the office, everybody needs to be familiar with that, because when let's say they're asked by a friend, not even a patient of yours, but they know that the team member is involved in dentistry. Well, they can say, Dr. Stephane Reinhardt did a very informative thing about clear aligners. I mean, I don't know if such a thing exists for other things in dentistry. I know in orthodontics during the pandemic that this same legal authority that you can link into, the comment that was made was, you need to know which of your patients are involved in orthodontic treatment that is not self-limiting. Mm-hmm. It is not self-limiting. That could be something like a Herbst appliance or a Forceps appliance, or certain types of nitinol springs, where things could get over the top and go out of control. Those patients wearing rubber bands. Well, do you need to contact the patient and explain to them, until I see you, I'd like you to not wear the rubber bands? Well, you could do it virtually. Mm-hmm. You could look at them virtually and make a decision. Do you really need to come to the office? Yeah. And I really wonder how many people put that information out there very, very quickly and have kept the information updated. And this is all part of what we...
it's going to be all part of the next episode of...
Safety in dentistry, making people feel safe.
Yeah, I think next episode will be on the safety in dentistry. Yeah, there's a lot to say about that. Again, it's going to be very interesting, and it's always always important. Not only now, maybe we talk about it more now, but it's always a topic of interest.
Well, things have changed in ways that we can't even imagine, and they're permanent changes. Mm-hmm. They're permanent changes, and this thing about the cornerstones of Disney, which I think we should look at for another podcast, are safety. Let me see if I can remember. These are the 4 pillars of the Disney Corporation: safety, showtime or entertainment, courtesy, and efficiency. Those are the 4. Mm-hmm. Safety, courtesy, showtime or entertainment, and efficiency. Mm-hmm. Now, of the 4, which is the most important that overrides everything else? To Disney, one of the most successful corporations probably in business history, worldwide. Which is the most important one, do you say, Stephane?
Safety.
You can't enjoy yourself if you don't feel safe.
Feel safe. That's it.
I mean, think of your own friendships. I'm talking about your personal friendships. You feel very safe within the confines of the friendship, or it won't last. It cannot last.
Exactly.
There's a trust that's there. Safety and trust are 2 sides of the same coin. And what we'll talk about next time is how we'll talk about between the 2 of us. And if you'd like to email, or I don't know how you're going to handle this stuff.
You can email, you can write, just write in the comments. Here, you can write your questions, your comments, things you would like us to cover about, especially that next topic, or just write what you thought about this podcast.
Yeah, and if it's something you didn't like, well, I invite you to not come back.
That's it. That's it. It's okay. You don't. Not everybody has to like it. I'm fine with that.
Yeah. Some people like round glasses and some people don't.
Exactly. But
some people like... All right, Stephane.
But Gerry, yeah, always interesting. Again, it's exactly how it is all the time. We just keep talking and talking and talking, and it's always fun, entertaining, and enlightening.
Well, I'll look forward to seeing how you divide these segments up. I find your creativity in that quite interesting. So, Stephane, stay safe, and it'll be nice when I can see you again and breathe the same air.
Yes.
Press flesh.
I look forward to that. The next time I see you, and the big hug I'm gonna give you and get back in return. Gerry. So again, we say the same thing. Au reservoir, Gerry.
Au reservoir. Oh, how do you say it? Let me try to say it in French. What is it?
Au revoir.
Au revoir.
Au revoir. Au revoir, Gerry.
Au
Not that bad. You were better saying patate.
Patate.
Say patate pilée.
Patate pilée.
You almost have a Québécois accent.
Oh, I can only hope.
Yeah.
So, ciao.
Hey. Ciao. Be safe. Bye. There you have it. Episode number 2 of The Odd Couple. Join us next time for episode number 3, where we will talk about safety. Being safe, feeling safe. Meanwhile, keep creating smiles. And always make sure that your center of rotation is outside of the box. So as Gerry would say, au reservoir.